She was escorted out of her own emergency room with her badge stripped from her chest. And 30 minutes later, she was the only person in that building keeping people alive. Emily Carter didn't ask for the recognition. She didn't demand an apology. She just pulled on a pair of gloves, walked back into the chaos, and did what she'd been doing since long before anyone at Redwood Valley Medical Center ever learned her name. What they didn't know, what they'd never bothered to find out, was that Emily had already survived things that would have broken every single one of them. This is her story, and it starts with a mistake that wasn't hers. If this story hits you the way it hit me writing it, subscribe, hit that like button, and drop your city in the comments. I want to see how far this story travels. From wherever you're watching, let me know you're here. The trauma bay doors blew open at 6:47 in the morning, and the sound that followed wasn't screaming, it was silence. The particular kind of silence that happens when a room full of trained professionals sees something bad enough to make them stop moving. The patient was a 43-year-old male, construction worker, name unknown. He'd come off a scaffold 3 stories up. Both legs were wrong. Not broken wrong, but wrong. The kind of wrong that meant someone had to make fast decisions and live with them. His pressure was dropping. His pupils were uneven. And the paramedics who'd brought him in were talking too fast, their words stepping on each other, which meant even they were scared. Emily Carter was already at the bedside before the gurney locked into place. She'd been on since 11 the night before, 8 hours into a 12-hour shift, running on her 3rd cup of bad coffee and a granola bar she'd eaten standing over a supply cart at 3 in the morning. Her dark hair was pulled back tight enough to pull at her temples, and there were smudges under her eyes that no amount of sleep seemed to fix anymore. She was 31 years old, and she looked it. Not in a bad way, just in the way of someone who'd been doing hard things long enough that her face had started to remember them. She got her hands on the man's wrist, checked his pulse against the monitor. Her eyes moved. IV site, airway, chest rise, the way his left hand kept curling even though he wasn't conscious. Decorticate posturing on the left, she said. He's got intracranial pressure building. We need neuro now. I'll call it in, said Marcus Webb, the charge nurse beside her, already reaching for the phone. Also get me a repeat BP in 2 minutes. If it drops again, we need to talk about a second line. She was already moving, adjusting the drip rate on his IV, checking the tube placement, doing 3 things at once in the calm, unhurried way that either came from experience or from a particular kind of wiring that not everyone had. She had both. That was when Dr. Harlan Greer walked in. Greer was the chief of surgery at Redwood Valley Medical Center, and he walked the way men walk when they've been the most important person in a room for long enough that they've forgotten rooms exist without them. He was 56, silver-haired, built like someone who'd been athletic once and hadn't quite let go of the memory. He wore his ego the way he wore his white coat, like it was a credential. He took one look at the patient, one look at Emily's hands on the IV line, and his expression shifted into something that wasn't quite annoyance and wasn't quite contempt. It was the specific look of a man who'd already decided what he was seeing before he'd finished looking. Who adjusted this drip rate? Emily didn't look up. I did. His pressure was, I didn't ask for your reasoning. He stepped to the other side of the gurney. I asked who touched my patient's medication without an order. Marcus stiffened beside her. Emily's hands kept moving. Steady, not performing steadiness, just steady. There wasn't time for Carter. Greer said her name the way you'd say enough. Step back. She stepped back. Not because she agreed, but because she'd learned, in the particular school that women learn things like this, that the fight you pick in front of a patient is a fight you lose twice. Greer leaned over the man, made a show of checking the same things she'd already checked, and then turned to the resident standing nearest the door. Get me a CT order and call neuro. Let's get a proper assessment. It was everything she'd already called for. Word for word. She didn't say anything. The morning moved the way bad mornings move. Fast where it should be slow, slow where it should be fast. 3 more patients came through. A 7-year-old with a broken arm and a mother who was holding it together badly. A 60-year-old woman with chest pain that turned out to be nothing, and then turned out to be something, and then required a conversation that nobody in the department wanted to have at 7 in the morning. A 20-something with a laceration on his forearm that he said was from a fence, and that Emily was pretty sure wasn't from a fence. She handled them all. She charted between patients, standing at the nurse's station with the particular efficiency of someone who'd long since stopped expecting a chair. She caught a medication error on a discharge summary, the wrong dosage on a blood thinner, the kind of mistake that showed up quiet and left loud, and flagged it before it reached the pharmacy. Nobody thanked her for that, either. That was fine. She hadn't done it for thanks. At 8:15, Dr. Greer called a department meeting in the small conference room adjacent to the nurse's station. Emily stood near the back because there weren't enough chairs, and because standing near the back of rooms had become a habit she'd developed somewhere between the army and here and had never quite broken. Greer stood at the front with a printed report in his hand and the particular expression of a man preparing to be disappointed in public. "Overnight incident review," he said. "Mrs. Darlene Kovach, 64, admitted at 2:18 with chest pain and shortness of breath. Initial assessment noted possible anxiety, recommended observation, and discharge." He paused. "She went into VFib at 4:30. She's in the ICU." The room was quiet. "The initial assessment was wrong," Greer continued. "The presentation was atypical but not inexplicable. There were flags." He set the paper down. "I've reviewed the chart. The assessment was signed off by—" He looked up directly at Emily. "Nursing." She felt the room shift the way rooms shift when a target has been identified. "The attending on record was Dr. Solis," she said. Her voice came out even. "The nursing note flagged the irregular rhythm at 3:42. That's documented." "The nursing note is not a diagnostic decision." "No, but it was there. If the attending had Carter." The way he said it this time was different, flatter, more deliberate, the way you say a word when you want it to land like a period. "The record shows a failure to escalate appropriately. That failure is on this department's nursing staff." She looked at him for a moment. In another life, and in the life she didn't talk about, she'd looked at people who were actively trying to kill her with more composure than this. The comparison felt almost funny. Almost. "I escalated at 3:42, she said. "The chart reflects that." "Well, your interpretation of the chart and mine are apparently different." He turned back to the room. "I'll be filing an incident report. HR will follow up with the relevant staff." He gathered his papers. "That's all." People started moving. The resident who'd been taking notes on his phone slipped out first. Then the other attendings. In the careful way of people who know a storm is coming and have decided not to be under it. Marcus caught Emily's eye across the room and gave her the very small, very specific look that said, "I'm sorry, I can't do anything. I'm sorry." She walked back to the nurse's station and pulled up Mrs. Kovach's chart on the terminal. There it was. The note at 3:42 a.m., time-stamped, her login, her language. "Patient presenting with new irregular rhythm, rate 112. Patient reports increased dyspnea. Notified Dr. Solis per protocol." Below it, in Solis's notation at 3:58, reviewed. Continue monitoring. She had escalated. She had documented. She had done the thing. None of that was going to matter. She'd been doing this long enough to understand how these stories end when the person with the title decides how the story goes. Greer found her at 10:20, which meant he'd waited long enough to let the earlier conversation settle, which meant this was deliberate. He came with Sandra Pruitt, the nursing supervisor, a thin woman in her late 40s who had the particular quality of someone who'd learned to survive institutional bureaucracy by making herself as frictionless as possible, never quite becoming the thing doing harm, but never quite standing in its way either. "We need to speak with you," Greer said. They went to a small room off the main hallway that was used for family consultations, and apparently for this. The three of them sat at a round table that was too small for the conversation they were about to have. "The Kovach incident," Greer began, "represents a significant lapse in protocol. Combined with the unauthorized medication adjustment this morning, that adjustment kept his pressure from crashing before the CT. Combined with the unauthorized adjustment," he continued, as though she hadn't spoken, "there's a pattern of judgment calls that fall outside the scope of nursing practice. At Redwood Valley, we have systems in place for a reason." Sandra was looking at the table. "Those systems exist to protect patients," Emily said. "I used them. I notated, I called, I flagged. If there's a pattern here, It's not mine. Greer's expression didn't change. Effective immediately, you're being placed on administrative leave pending the incident review. You'll surrender your badge to Sandra, and you won't return to the floor until HR completes its process. The room was very quiet. You can't... She stopped, took one breath. This is retaliation for questioning the chart review. This is standard protocol. Harlan. She used his first name, which she never did, and she watched it land. You know what I flagged was real. You know what that note says. Whatever you're protecting right now, it's not this hospital. Something moved across his face. Not guilt, exactly, but the shape of guilt. The shadow it left when someone had already decided guilt was a cost they'd pay later. Your badge, Ms. Carter. She looked at him for a long moment. Then she unclipped it from her scrub pocket and set it on the table. She didn't put it down hard, didn't make a show of it. She just set it down and stood up and walked to the door. You're making a mistake, she said, without turning around. Nobody answered. The parking lot of Redwood Valley Medical Center was the kind of institutional gray that absorbed light without doing anything interesting with it. A long rectangle of asphalt flanked by half-dead hedges and a handful of sad trees that the hospital clearly intended to look welcoming and which succeeded only in looking like they were trying. Emily stood by her car, a 7-year-old Subaru with a dent on the rear quarter panel that she kept meaning to fix, and did nothing for about 90 seconds. She wasn't crying. She was past crying about things like this. Or maybe she was so deep into the territory past crying that she'd forgotten the geography of it. She was thinking about Mrs. Kovacs, who was 64 years old and in the ICU, and who had done nothing wrong except trust a system that had been too slow. She was thinking about the chart note at 342, the one that existed, the one that didn't matter. She was pulling her car keys out of her jacket pocket when she heard it, a low, organized sound, the kind of sound that doesn't belong in a hospital parking lot. She looked up. 3 black SUVs and a military transport vehicle were rolling through the hospital entrance, moving in the tight, purposeful formation of people who had a destination and were not in any hurry because they didn't need to be. They were unhurried the way certainty is unhurried. They pulled into the main lot and stopped. Doors opened. 6 soldiers in service dress stepped out. Not combat gear, but not casual either. The kind of uniform worn when the message isn't, we're ready to fight, but we represent something that doesn't need to explain itself. A 7th figure climbed out of the center vehicle. A woman, late 40s, short-cropped, silver-streaked hair. The particular bearing of someone who had been in command long enough that they wore it in their spine. Full-dress uniform. Insignia Emily recognized without wanting to. Colonel Diane Marsh. Emily's hand stopped moving. She hadn't seen Marsh in 4 years. She hadn't spoken to her in 3. She hadn't said her name out loud in longer than that, and she'd certainly never expected to see her here, in this parking lot, in this state, outside this building that had just handed Emily back her badge like it was an inconvenience. Marsh's eyes found her across the lot, not searching, not scanning, just finding, the way someone finds something they already knew exactly where to look for. She started walking toward her. Emily stood very still. Carter, Marsh said when she was close enough that it wasn't a shout. Her voice was exactly as Emily remembered it, measured, direct, the kind of voice that didn't use extra words because it didn't need them. Colonel? Emily's voice had gone somewhere careful. You're a long way from... We've been trying to reach you for 6 days. Marsh stopped 2 feet away. You changed your number. I changed my number. I know. A pause. We need to talk. I was just leaving, actually. She gestured at the Subaru in a way that was not quite a joke. Turns out I have the morning free. Marsh looked at the hospital, then back at Emily. Something moved in her expression, but not pity, which Emily wouldn't have tolerated, but something more careful than that. Recognition, maybe, of a specific kind of damage. What happened in there? Nothing I can't handle. Carter. It's handled, Colonel. She said it with the particular flatness of a door closing. What do you need? Marsh studied her for a moment, the kind of study that had never been about doubting Emily and had always been about reading a situation accurately. There's a situation developing, she said. Multi-vehicle collision on I-78, about 40 minutes east. Bus, 2 semis, multiple passenger vehicles. Early reports are putting casualties at 30 plus, critical. The nearest level 1 trauma is... She glanced at the hospital behind them. This. Emily said nothing. We have military personnel in those vehicles, Marsh continued. Fort Del Mar was running a transport. 2 of those casualties are active duty. 1 is a specialist with specific medical considerations that the staff here may not be. The sound hit before she finished the sentence. Not loud at first. A low, compressing wave of noise that seemed to come from the direction of the highway. The east, the direction Marsh had gestured. And then resolved itself into something specific. Sirens. Multiple sirens, layered over each other, growing. Then the first ambulance turned into the hospital drive, then the second, then 3 more behind it. The radio on the nearest soldier's belt crackled, and through the static came a voice that was trying very hard to stay professional and not quite succeeding. Multiple critical, at least 8 unconscious on arrival, requesting all available trauma staff, all available. Marsh looked at Emily. Emily looked at the ambulances pulling into the bay, at the doors slamming open, at the gurneys rolling out with a speed that said there wasn't enough time for anything that wasn't essential. She looked down at her hands. No badge. No authorization. No standing in that building, per Harlan Greer and Sandra Pruitt. And the system they'd decided mattered more than Mrs. Kovach's chart note. She looked back at the bay. I'm going to need gloves, she said. She was already moving before Marsh could answer. The trauma bay had gone loud in the particular way of mass casualty events, which was not the Hollywood version, not screaming, not chaos for its own sake, but the specific controlled loudness of too many urgent things happening in too small a space with not enough people who could handle any of them. Emily pushed through the doors and assessed in 4 seconds. 6 gurneys, 3 actively crashing, 2 more incoming from the ambulance bay, 1 resident who looked like she'd read about mass casualty events but hadn't lived one yet, and Dr. Greer standing in the center of it all, with his hands at his sides and his mouth open, and an expression on his face that she'd seen before on people who'd been competent their whole lives and had just hit the ceiling of it. She grabbed gloves from the wall dispenser, didn't ask permission, didn't pause, and moved to the nearest critical, male, mid-30s, massive blunt chest trauma. His breath sounds were wrong on the left, and not wrong quiet, but wrong absent. Tension pneumo, she said to the resident nearest her. A young woman named Dr. Reyes, according to her badge, who was doing her best and whose best was going to need some help. Tracheal deviation, right? You need to needle decompress, left second intercostal, mid-clavicular line. Reyes looked at her. You're not... I know. Emily's hands were already moving, setting up the field. You're going to do it. I'm going to tell you exactly how. Go. Reyes went. Across the room, another alarm. This one, the flat continuous tone that meant a heart had stopped doing the thing hearts were supposed to do. Emily looked. A woman, older, maybe 60. The monitor showing ventricular fibrillation. The attending who should have been at that bedside was 3 feet away. On the phone, apparently trying to reach the chief cardiology fellow at a moment when the patient in front of him was in cardiac arrest. Somebody start CPR, Emily said. Not loud, just clear. Nobody moved. Now! A tech started compressions. Emily crossed to the crash cart, pulled the defibrillator, checked the charge level, checked the pads. Clear. She'd done this in places where the building was shaking, once in a vehicle that was still moving. The steadiness wasn't something she performed. It lived somewhere below performance, in the architecture of her. The shock went in. The monitor hiccuped. Then, reluctantly, a sinus rhythm crept back across the screen. Resume monitoring, she said to the tech. If she converts again, reload and go immediately. Don't wait. She was already moving. Greer had found his voice somewhere in the last 90 seconds, and now he used it. Carter. Carter. She didn't stop. You are not authorized to be on this floor. I want you... There's a tension pneumo in Bay 3 that Dr. Reyes is handling, and she's going to need supervision. The woman in Bay 5 needs a repeat rhythm check in 4 minutes. The man in Bay 2 has a GCS of 7 and dropping, and nobody has called neurosurgery yet. She turned and looked at him. Tell me which one of those you'd like me to stop doing. Greer's face did something complicated. Behind him, through the trauma bay doors, Colonel Marsh stepped inside. She didn't say anything. She didn't need to. She stood near the entrance with two of her soldiers, and she watched. And the watching itself changed the air in the room in a way that Emily felt in her peripheral vision and didn't have time to think about. A new gurney came through the doors. Military uniform. Young. Maybe 22, 23. His left arm was wrapped in a field dressing that someone had applied correctly, which meant there had been someone with training on scene. His abdomen told a different story. The kind of injury that looked survivable until it wasn't, that had a window, and the window was not large. One of Marsh's soldiers stepped forward. That's Specialist Dorian Hayes. He has a platelet function disorder. Documented. I need the full medical record, Emily said. Right now. It's on the drive. The soldier produced a USB from his breast pocket. It's flagged under his name. She took it without breaking stride, plugged it into the portable terminal at the bedside, pulled Hayes's chart in 15 seconds. The platelet disorder changed the calculus on everything. It meant the standard approach to his abdominal bleed was going to go wrong in a specific and very fast way. It meant whoever operated on him needed to know that going in, not find out in the middle. Who's on surgical call? She asked the room. Nguyen, someone said. He's in OR 2. Get him on the phone. Now. Tell him we have a coagulopathy with abdominal penetrating trauma and I need to talk to him in the next 3 minutes. You're not a doctor, Greer said. His voice had changed. The authority was still in it, but it had shifted. It was the authority of a man holding a position he was starting to suspect he couldn't hold. You cannot direct surgical consultations. I'm not directing a consultation. She looked at him across the room, across the noise and the monitors and the 4 people in the process of either surviving or not. I'm making sure the surgeon walking into that OR has the information he needs to keep that kid alive. If you want to stop me, you're going to have to physically remove me. A pause. And I'd really like to see you explain that to Colonel Marsh. The room went fractionally quieter. Not silent. Nothing here was silent, but quieter in the way of people recalibrating. Greer looked at Marsh. Marsh looked at Greer with the expression of someone who has not said anything and intends to let that continue for now. Greer looked back at Emily. He didn't move. Emily turned back to Hayes. Okay, specialist, she said, quieter now, just for him, even though he was only partly conscious. I've got your chart. I know what you need. We're going to take care of this. His eyes moved toward her voice. Something in his face, young, scared, in pain, a long way from wherever Fort Delmar was, shifted very slightly towards something that wasn't quite trust, but was in the same neighborhood. Outside the trauma bay doors, through the narrow window, Emily could see more gurneys coming, more sirens pulling into the lot. The day was expanding into something that had no clean edges, no foreseeable end, no version of itself that was going to be easy. She pulled her gloves tighter and moved to the next bed. Dr. Greer stood in the center of the room and watched her work. And for the first time that morning, he was not the most important person in it. The next gurney came through at a bad angle. One wheel catching the door frame, the paramedic on the left overcorrecting. The whole thing lurching in a way that sent the IV bag swinging and the patient's head rolling to the side. Emily was there before the gurney stopped moving. Female, late 40s, seatbelt bruising across the sternum in a pattern that said the belt had done its job and also done significant damage in the process. Her breathing was labored, not absent, but working too hard, the kind of breathing that had a deadline on it. Right side of her face was road rash raw. Her left hand was gripping the side rail with the automatic strength of someone unconscious and terrified. Emily put 2 fingers on her wrist, looked at the monitor reading the paramedic was relaying, and ran the math without running the math. The way you do when you've done it enough times that the steps live in your hands and not in your head. Probable sternal fracture, possible cardiac contusion, she said. I need a 12 lead now, and I need someone to check breath sounds bilaterally before we do anything else. Reyes appeared at her elbow, the same resident she'd guided through the needle decompression 20 minutes ago, who had done it correctly and was now moving through the department with slightly more purpose than before. Not confidence, exactly. More like someone who discovered the floor was solid and were cautiously testing their weight on it. I can take the 12 lead, Reyes said. Good. Watch the ST segments on 2 and 3. If you see elevation, you call me immediately. Not in a minute, not after you've thought about it. Immediately. Understood. Emily was already turning. The department had found a rhythm. Not a good rhythm. Not a rhythm anyone would have chosen, but a rhythm. The controlled chaos of mass casualty had settled into something slightly more organized, which was its own kind of dangerous because organized chaos was when people started cutting corners they didn't know they were cutting. She moved through it, bed to bed, problem to problem. A man in Bay 6 with a femur fracture that was bleeding internally at a rate that would turn survivable into not survivable somewhere in the next hour. An elderly woman whose blood pressure was so low the monitor kept erroring and rereading, confused, which Emily understood because she was confused too until she checked the medication list and found the antihypertensive that nobody had flagged on intake. She flagged it. She moved on. Specialist Hayes was still in Bay 4. She checked on him between everything else. Not hovering, because hovering didn't help, but checking. His pressure had stabilized a little. The surgical consult with doctor. When it happened, the information she'd relayed about the coagulopathy had been received, and Nguyen had adjusted his pre-op plan in a way that the surgical fellow who'd relayed the message back to her had described as pretty significant. She noted that and filed it away and went back to the femur fracture. Greer was still in the department. She was aware of him the way you're aware of weather, not looking directly at it, but knowing where it was. He had found his footing again somewhat. He was directing residents, reviewing orders, doing the work. He was a competent surgeon on a normal day, and this was not a normal day, but he was managing. What he wasn't doing was what he'd been doing 2 hours ago. The particular quality of certainty he'd carried, the absolute ease of someone who'd never had to question where they stood, that was gone. It had been replaced by something smaller and less settled. He was watching her, Emily knew, the way you watch something that has rearranged your understanding of a room without asking your permission. She didn't look at him. She had enough to do. At 11:40, the department caught its first breath. Not because it was over. There were still 9 patients active, 2 in the OR, 1 waiting on a specialist who was stuck in traffic, but because the flood had slowed to a stream and the stream was manageable. People found water. Someone produced a box of protein bars from somewhere, and they disappeared in under 4 minutes. Rhea sat down on a rolling stool against the wall and put her head back and closed her eyes for 30 seconds, which Emily recognized as the medical resident version of a full night's sleep. Marcus Webb appeared at Emily's shoulder. "You okay?" he said. Not loudly, the way you say it when you actually want to know. "I'm fine." That's a very specific kind of fine. She looked at him. Marcus was 43, broad-shouldered, had been charge nurse on this floor for 9 years, and had the quality of someone who'd seen enough that very little surprised him. And the things that did, he handled by getting quieter rather than louder. He was one of the 3 people in this building she actually trusted, which was 2 more than she'd trusted anywhere else she'd worked. "It's been a morning," she said. "Yeah." He paused. "Greer's not happy." Greer was never happy. That's not new information. "He's been talking to Pruitt, and I heard him on the phone with someone from admin." Marcus's voice stayed level, but something in it shifted. "Emily, whatever happened in that meeting earlier, it's not done. He's going to make sure it's not done." She knew that. She'd known it from the moment she'd set her badge on the table. The things she'd done this morning, coming back in, taking over, saving the people Greer's department hadn't been able to save. That didn't reset anything. If anything, it made it worse. Because men like Greer didn't revise in response to evidence. They dug. "I know," she said. "Just," he stopped. "Be careful." "I'm always careful." "No," he said. "You're always right. That's different." She didn't have an answer for that, and he didn't wait for one. He went back to the station, and she went back to the femur in Bay 6. Colonel Marsh found her at noon, in the small supply corridor behind the trauma bay, where Emily had gone to restock the crash cart she'd depleted. The corridor smelled like antiseptic and cardboard, and the particular sterile nothing of hospital back spaces. A single fluorescent tube buzzed overhead. It was not a place designed for consequential conversations, but consequential conversations, Emily had found, had very little interest in design. "Specialist Hayes is in surgery," Marsh said. "Nguyen thinks he's going to make it. Good. The adjustment to the pre-op protocol. Marsh wasn't asking. That was yours. I flagged it. Gwen made the call. Emily. He made the call, Colonel. I gave him information. That's different. Marsh studied her. You've gotten more careful with credit. I've gotten more careful with a lot of things. The fluorescent light buzzed. Somewhere through the wall, a monitor alarm went off and then stopped, addressed, handled, filed away. I need to tell you why we came, Marsh said. You mentioned a transport. I assumed that was real, but it wasn't the only reason. She paused, and Marsh was not a woman who paused without purpose. There's been a formal inquiry, filed 3 weeks ago with the Inspector General's office. It concerns this hospital, specifically the administration. Emily went still. What kind of inquiry? Pattern of incident report falsification, misattribution of medical errors to non-physician staff, specifically nursing. Marsh held her gaze. We've been gathering documentation. The IG's office has been gathering documentation. When the transport came in this morning and this was the receiving facility, that's why I came in person instead of sending someone else. The supply corridor felt smaller than it had a moment ago. How long? Emily asked. Her voice had gone very flat. The documented pattern goes back 14 months, but there are indicators it goes back further. 14 months. Emily had been at Redwood Valley for 18. She thought about the chart note at 342, about Mrs. Kovacs in the ICU, about the way Greer had said her name in that conference room, not as though he was making a decision, but as though he was executing one that had already been made somewhere she couldn't see. The Kovacs incident, she said, is on record. He used it this morning to pull my badge. Marsh's jaw tightened, a small movement, the kind she made when she was angry and not showing it. I know, I was there. That's why they came for me today, isn't it? Not just because I challenged the chart review. They wanted me out before the inquiry got here. Marsh didn't answer, which was an answer. Emily looked at the wall. In the low buzzing light of the supply corridor, in scrubs that weren't hers, and with no badge and no standing in this building, she thought about the past 4 years. The years after she'd come back. The years of rebuilding something quieter and smaller than what she'd had before. Something that was supposed to be simpler. She'd thought she'd found it here. She'd thought a community hospital in a mid-sized city was far enough from everything that it couldn't find her. She'd been wrong about that. What do you need from me? She asked. Your testimony, your documentation, anything you have. Marsh paused. And I need you to know that when this moves, and it's going to move fast, Emily, the IG doesn't sit on things like this. You're going to be in the middle of it. I'm already in the middle of it. More so. She absorbed that. It didn't take long. She'd been in positions with worse geometry and less support. Okay, she said. Okay? I said okay, Colonel. She picked up the crash cart supply box she'd been restocking and tucked it under her arm. What? But right now I need to get back out there, because there are still 8 patients who need looking after, and apparently I'm the most functional thing in this department. Marsh almost smiled. It was a very small thing, the smile, barely a shift in the line of her mouth. But Emily had known Marsh long enough to recognize it. You haven't changed, Marsh said. I've changed plenty. She pushed open the corridor door. I just hide it better. The afternoon moved differently from the morning. The morning had been all instinct and emergency, no time to think, just move and act and solve. The afternoon was the part after, which was in some ways harder, the part where the adrenaline had cleared out and left the actual situation behind, unfiltered and lit. Hayes came out of surgery at 2:15. Gwen's fellow found Emily at the nurse's station to relay the update, which he did with the particular precision of someone who'd been told specifically to find her. Dr. Nguyen said to tell you the coagulopathy flag was what made the difference. He said, and here the fellow checked his phone, apparently reading a text directly, quote, whoever caught that kept him alive, and I want to know who it was. Tell Dr. Nguyen it was a team effort, Emily said. The fellow looked like he suspected that wasn't quite true, but wasn't sure how to say so. He left. Marcus appeared beside her. Nguyen's asking about you by name now. I know. That's the 4th attending today who's... I know, Marcus. I'm just saying it's noticeable. Everything I do here is noticeable. That's the problem. She pulled up the discharge paperwork on the terminal. Has anyone updated Mrs. Kovach's family? Solis did, an hour ago. Is she stable? Stable-ish. They're monitoring for arrhythmia. Emily nodded. Stable-ish was not good, but it was not bad. And it was where Mrs. Kovach had been at 3:42 in the morning when Emily's chart note had said exactly that. And she felt the particular exhaustion of having been right in a way that hadn't helped anyone. At 3 o'clock, Sandra Pruitt came back. She came alone this time, which was different from the morning. No Greer at her shoulder, no authority on loan. She looked like someone who'd been told to deliver a message she didn't entirely agree with and had decided the best way to do it was quickly. Emily, she stopped a few feet away. Her voice was lower than usual. I need to let you know. Administration has completed the preliminary review of the incident report. You're being asked to leave the premises today. Until the formal process. I'm not on the floor, Emily said. I've been handling paperwork at the station. You're still in the building. Patients I assisted with this morning still have open charts. Emily. Sandra stopped. Something shifted in her face. Not quite guilt, but adjacent to it. The expression of someone who'd been practicing neutrality and was feeling the cost of it. I know what happened in the meeting this morning wasn't... She stopped again, started differently. I'm just telling you what I was told to tell you. I know. I'm sorry. I know that too. Emily saved the document she'd been working on and logged out of the terminal. Is Greer in the building? He left an hour ago. And the colonel? Marsh? Sandra blinked. Yes, she's still here, in the administrative conference room. She asked for a meeting with the board chair. Emily stood up. Okay. Okay? Sandra repeated. It was apparently the word of the day. I'll gather my things. She picked up her jacket from the back of the chair. Thank you for telling me yourself. Sandra opened her mouth, closed it, nodded once, unhappily, and walked away. She was in the locker room when her phone buzzed. A number she didn't recognize, but the area code she did. Fort Delmar, 60 miles east. She answered. Carter? A male voice, older, slightly gravel-voiced. Not Marsh, someone else. This is General Warren Platt, IG liaison attached to the Fort Delmar command. I'm in contact with Colonel Marsh. She sat down on the bench in front of her locker and waited. We're accelerating the timeline on the Redwood Valley Review, Platt said, based on what Colonel Marsh observed this morning, and on materials already in our possession, we're executing a formal administrative inquiry. That means investigators on site. It means document holds on the hospital's incident reporting system. And it means any personnel actions taken in the last 24 hours relating to the individuals of interest in our inquiry are going to receive significant scrutiny. Including my administrative leave, she said. Including that, yes. A pause. I want you to understand the scope of what we're looking at, Ms. Carter. This isn't just about this morning. We have 14 months of documented pattern evidence suggesting systematic misattribution of medical errors at this facility. Errors made or enabled by senior physicians being attributed to nursing and support staff. The Kovach incident, as it's been described to me, appears consistent with that pattern. Emily's hand was flat on her knee. She noticed it there, very still. What do you need from me? She said. It was the same question she'd asked Marsh in the supply corridor, and she noticed that it had become the question she kept asking, the one she was most comfortable with. Not what happens now or what does this mean for me, just what do you need? Right now, nothing you don't already have. Your personal documentation, any records you've kept of flagged incidents, dates, names. If you have anything in writing, texts, emails, notes, preserve all of it. Another pause, shorter. And Ms. Carter, don't leave town. She almost laughed. I just got told to leave the building. The building, yes. The city, no. His voice had something in it that wasn't quite warmth, but was close. The voice of someone who had read a file on her and understood what the file didn't say. You've been handling things here the hard way for a while. That's going to change. The call ended. She put the phone in her pocket and looked at her locker. Inside, a change of clothes, a worn paperback she'd been reading in 15-minute increments for the past month, a photograph she kept face down that she almost never looked at and couldn't bring herself to throw away. Standard locker contents for someone who'd learned to keep their life in a small footprint. She thought about what Platt had said. 14 months of documentation, evidence already in their possession. Whatever she'd been caught in, whatever Greer had built and Sandra had helped maintain and the system had enabled, it was bigger than she'd understood, and it had been seen from the outside in a way it couldn't see itself from within. She'd known something was wrong here. She'd known it the way you know things you can't prove. The way the shape of something reads as wrong before you've identified the specific piece that's off. She'd stayed anyway because the patients needed someone staying, and because leaving felt like letting them win, and because she'd promised herself after she came back from everything she'd come back from that she was going to build something that lasted. She was tired of starting over. She closed the locker without taking anything. On her way out, her second time in the parking lot today, her second departure from Redwood Valley Medical Center with nothing resolved and everything pending, she passed the family waiting room adjacent to the ER. Through the window, she could see them, 8, 9 people, some in each other's arms, some sitting alone with the particular stillness of people who have exhausted the option of movement. Family members of the morning's casualties. Some of them had been there for 6 hours. A woman in the far corner was talking on the phone in a low, urgent voice, her free hand pressed flat to the glass of the window, looking out at nothing. Emily stopped walking. She stood outside the waiting room door for a moment. Then she pushed it open. She didn't have a badge. She wasn't on duty. She had no official standing, and she knew, in the very specific way of someone who'd been removed from official standing twice today, that walking into that room was outside the scope of what she was permitted to do right now. She went in anyway. The woman on the phone looked up. So did an older man in the corner who had the look of someone's father, the particular stricken quality of fathers who had always believed their job was to fix things and had found a situation they couldn't fix. "Hi," Emily said. She kept her voice quiet. "I'm Emily Carter. I was one of the nurses working this morning when your family came in. I don't have any official news for you. A patient care representative should be coming to update you soon. But if you have questions, I can try to answer what I can." Nobody spoke for a second. Then the father said, "My son, they said he was in surgery." "What's his name?" "Patrick. Patrick Dower. He was in the blue. He was driving the—" "I know who Patrick is," she said. Not because she remembered his name, she hadn't known his name, but because she recognized the injury pattern he was describing. The man from Bay 2, the GCS of 7, the neurosurgery call she'd demanded before Greer could redirect her. He was being cared for by the neurosurgery team. Last I knew, they'd taken him up. I don't have surgical updates, but the fact that he went to the OR means the team had a plan. The father's jaw worked. Is that good?" "It means they had a plan," she repeated, gently, because honest was more useful than comfortable. "A patient care rep is going to have more current information than I do." He nodded. His eyes were wet, and he was holding them steady, with the effort of a man who'd decided he was not going to fall apart in public, and Emily respected that, and she also knew it was costing him considerably. She spent 18 minutes in that room, answering questions where she could, sitting with silences she couldn't fill. It was the part of the job that didn't have a protocol. No chart for it, no order to write, just presence, which was sometimes the only thing that was actually available to give. When she left, the father caught her arm. Not hard, just the touch of someone who needed one more second. "Thank you," he said, "for being in there this morning. Someone told us—" He stopped, collected himself. "Someone told us you were the one who made sure they called the right people for Patrick." She didn't know who'd told him that. It might have been true. It might have been incomplete. She didn't correct it. "Your son was in good hands," she said. "The whole team." Outside, the afternoon air was cool and flat, and the parking lot was quieter than it had been. The military vehicles still present, but settled, no longer arriving. One of Marsh's soldiers was leaning against the transport van with a coffee, scrolling his phone, perfectly ordinary in the way of military personnel waiting for orders. He looked up when she passed and gave her a brief nod that contained something she recognized, a specific quality of recognition, soldier to soldier, that had nothing to do with rank and everything to do with having been in the same category of difficult situations. She nodded back. She found her Subaru. She got in. She sat for a moment with her hands on the steering wheel and looked at the hospital, its institutional face, its lit windows, its ordinary exterior that looked nothing like the inside of it. Her phone buzzed. A text from Marcus. "Greer's back. He's in admin. Pruitt called a staff meeting for 4 p.m. Whatever Marsh said to the board chair, it didn't land quiet. She looked at the text for a moment. Then another buzz, same number. Also. Somebody pulled the security footage from last night. All of it. Not admin. Someone external. She looked at that one longer. The security footage from last night would have the timestamp on her chart note. The exact moment she'd notified Solis, documented in the system's own record, visible to anyone who pulled the log with the right access. It would show the 3-minute gap between her documented escalation and Solis's response. It would show the gap between Solis's response and any attending intervention. It would show everything Greer had told that conference room didn't exist. She put the phone in her pocket, started the car. She'd been trying to leave this parking lot twice today. Both times, something had stopped her. She wasn't sure if this was the universe's way of telling her something or just the nature of bad days, that they accumulated before they resolved, that the exit you kept trying to take kept not being available because the story wasn't finished yet. She put the car in reverse. Her phone buzzed a third time. Not Marcus this time. The Fort Delmar area code again. Not Platt's number, a different one. She picked it up. "Carter," Marsh's voice. "Are you still in the parking lot?" She looked out the windshield at the hospital entrance. "About to leave." "Don't." A pause, shorter than Marsh's usual pauses, which meant something. "We have a situation. The board chair just ended the meeting early. Someone, and I don't yet know who, has been accessing and altering records in the hospital's incident reporting system in the last 2 hours." Emily's hand tightened on the wheel. "The IG's document hold was filed 40 minutes ago," Marsh continued. "Any alterations made after that hold went into effect are tamperable evidence. That means someone at this hospital, in the last 2 hours, made changes to official records after receiving notice that those records were under federal review." The parking lot sat in afternoon light. The soldier by the van had stopped scrolling his phone. "Harlan Greer came back to the hospital at 3:15, Emily said. "I know. He went to admin." "I know that too." A beat. "Emily, if we can prove who made those alterations and when, this isn't a hospital administrative matter anymore." She understood what Marsh wasn't saying. She understood the difference between a pattern of institutional misconduct and the specific deliberate act of tampering with records under a federal investigation. The difference was the difference between someone losing their job and someone losing their freedom. "What do you need me to do?" she asked. "Come back inside," Marsh said. "The IG investigators arrived 10 minutes ago. They're asking to speak with you." Emily looked at the hospital entrance, the glass doors, the ordinary institutional face of a building that had tried to push her out twice today and which she was apparently about to walk back into for the third time. She put the car in park. "I'm on my way," she said. She pushed the door open and started walking, and behind her, her car sat in the lot in the afternoon light, still running, still in park. She'd forgotten to turn it off. And that small, very human thing, that minor lapse of someone who had been carrying too much for too long and had just found out it wasn't over yet, was the most accurate description of her anyone could have offered in that moment. Not invincible, not calm by nature, just moving anyway. The automatic doors opened for her a third time, and this time the building felt different. Not because it had changed, but because she had stopped pretending it was something she needed permission to enter. The lobby was quieter than it had been at any point in the last 8 hours. The morning's flood had receded to a low tide. A few family members in chairs, a volunteer at the information desk, the ambient hum of a hospital in its afternoon phase. But off to the right, near the administrative corridor, something was happening. 3 people in civilian clothes with lanyards she didn't recognize. A hospital security guard standing in a posture that said he'd been told to stand there and wasn't sure why. A woman from the medical records department carrying a sealed banker's box with the expression of someone who'd been asked to do something unusual and was concentrating very hard on not asking questions about it. IG investigators moved like that. Contained, deliberate, the particular professional neutrality of people whose job it was to make institutions uncomfortable without telegraphing exactly how uncomfortable they were about to make them. Marsh was at the end of the corridor, standing outside a door that Emily recognized as the main administrative conference room. She was on her phone. She looked up when Emily came through, finished what she was saying in a short two-word exchange, and put the phone away. "They're ready for you," she said. "How many?" "Two. Civilian investigators from the IG's office, Sauer and Park. They've already pulled the system logs." She paused. The alterations were made from a workstation registered to Greer's administrative login between 3:22 and 3:47 this afternoon. Emily processed that. The document hold had been filed at 2:51. Greer had returned to the building at 3:15, according to what Marcus had told her. That left a very narrow window between his arrival, the moment he would have understood what was happening and the moment he sat down at a computer and decided to do something about it. "He knew," she said. "Someone told him about the inquiry before he came back." Marsh's jaw was doing the thing again. "We don't know who yet. Does it matter? The alterations are time-stamped. It matters for the full picture." A short pause. "It also matters because whoever told him may have been in a position to access the IG's filing before it was officially served." Emily understood the implication without needing it unpacked. Someone inside the hospital had known, not a leak from outside, a leak from within, from someone with enough access to see what was coming and make a call. She filed that and pushed open the conference room door. Sauer was older, mid-50s, reading glasses pushed up on his forehead, the kind of man whose authority came so completely from competence that he'd long since stopped feeling the need to signal it. Park was younger, maybe 35, with a tablet and a recorder and the focused energy of someone who had done a great deal of preparation for this conversation. They didn't waste time. "Ms. Carter," Sauer said, "I want to start with the Kovacs incident because it's the most recent and most documented. Walk me through what happened from your perspective, beginning with your first assessment of the patient." She walked them through it, all of it. The irregular rhythm at 3:42, the notification to Solis, the documentation, the lag, the morning meeting where Greer had used it, the way he'd framed it in front of the department. She was precise, and she was not emotional, and she did not editorialize, because she understood that editorializing was what people did when they didn't trust the facts to carry the weight, and she trusted these facts. Park was typing. Sauer was watching her. When she finished, Sauer said, "How many prior incidents like this, where your documentation was questioned or attributed differently, are you aware of?" "In my 18 months here? Directly involving me, at least 4 that I know were formally documented differently than I recorded them. Indirectly, patterns I observed involving other nursing staff, more." "Can you identify those staff members?" "Marcus Webb, charge nurse. He can speak for himself. Tina Ortega. She left the hospital 8 months ago. I don't know where she went. James Halford, he's still on the floor." She paused. "There may be others who didn't know what was happening to their records." "That last point," Park said, looking up from his tablet. "People who didn't know. Can you explain what you mean?" "The incident reporting system at this facility has tiered access. Nursing staff can submit and view their own reports. They can't see the final administrative resolution of those reports unless they're specifically looped in. So it's possible, likely, I'd say, that staff submitted accurate reports and the administrative resolution changed the attribution and they never saw the changed version." The two investigators exchanged a brief look. "That's consistent with what we've found in the system logs," Sauer said. He didn't say it with satisfaction. He said it the way you confirm a bad diagnosis, already knowing, just marking the moment of confirmation. The door opened without a knock. Emily turned. Harlan Greer walked in. Behind him was a man in a suit she didn't recognize, mid-40s, sharp-faced, the practiced calm of a hospital attorney. And behind that man was Sandra Pruitt, looking like someone who had been swept into a current they hadn't intended to enter. "This interview," Greer said, looking at Sauer, "is being conducted without the hospital's legal representation present. That's a procedural." "This is a federal inquiry," Sauer said. "You're not entitled to representation in an interview with a witness. You're entitled to your own counsel if you become a subject. A pause. Which, given what we found in the system logs 40 minutes ago, you may want to consider. The attorney put his hand on Greer's arm. Greer looked at Emily. She looked back at him. She'd imagined this moment before. Not this exact version, but something like it. The version where everything she'd documented and flagged and been told didn't matter suddenly mattered very publicly. She'd imagined it would feel like something large. It felt, instead, like something very still, like the moment after a storm when the damage is just beginning to be visible. You should wait outside, Sauer said to Greer. We'll be speaking with you separately. Greer's jaw worked. The attorney said something quiet near his ear. Greer turned and walked out, and the attorney followed, and Sandra stood for one moment too long in the doorway, looking at Emily with an expression that was equal parts complicated and exhausted. And then she left too. The door closed. Park looked at Emily. You okay to continue? Yes, she said. They went for another 40 minutes. By the time the interview concluded, the late afternoon light was going gold through the conference room windows, the particular gold that made institutional spaces look briefly like somewhere else. Sauer collected his notes and told her they'd be in touch, and Park confirmed her phone number twice. And then she was in the corridor again with Marsh. How'd it go? Marsh asked. They already know most of it. Emily leaned against the wall. Her legs were tired. It occurred to her that she'd been on her feet for most of 10 hours, on a shift that had ended and resumed and hadn't really ended. They're thorough. They are. Marsh paused. Hayes is out of recovery. He's asking about you. She blinked. He's conscious? Came around an hour ago. Groggy, but asking. Marsh had something in her expression that wasn't quite a smile, but was the territory next to it. He remembers your voice. Emily didn't say anything for a moment. She thought about the young specialist's eyes moving toward her voice in the bay, the not-quite-trust expression. I'll go see him. He's in surgical recovery on 3. Marsh looked at her. You still don't have a badge. I know. I'll walk you up. They took the stairs because the elevators in this hospital were slow, and both of them were people who took stairs. 3 floors, in the particular companionable silence of people who had known each other long enough that silence wasn't a problem to solve. At the second-floor landing, Marsh said, When this is over, and it will be over, Emily, I mean the inquiry, the investigation, there's going to be decisions to make about what's next. I know. I'm not pushing. I just want you to know the door's open. I know that too. She pushed open the door to the 3rd floor. Let's get through this first. Oh. Hayes was in a bed by the window in surgical recovery, pale and patched, and awake in the tentative way of people who've had general anesthesia and are still testing whether the world has continued normally in their absence. He was 23, up close. She'd thought 22 in the trauma bay, but she'd been working fast. He had dark circles that predated surgery, the look of someone who'd been running on insufficient sleep for weeks before the accident made it worse. He looked at her when she came in, and recognition crossed his face in a way that was slightly delayed, like something loading. You were there, he said. His voice was rough from the tube. I was there. She pulled up the chair next to the bed and sat down. How's the pain? Manageable. He looked at the ceiling, then back. The surgeon said there was a flag on my chart about my blood. He paused. He said it made a difference. You had that information in your file. I just made sure it got to the right person at the right time. Hayes was quiet for a moment. Then, my unit sergeant has a daughter. She's going to nursing school. He said it like it was a separate thought, but it wasn't. He says people don't appreciate what nurses actually do. Smart man. He'll want to hear about this. His eyes drifted a little, pain medication pulling the edges soft. Can I tell him your name? Emily Carter, she said. He repeated it once, quietly, like he was filing it, and then his eyes closed in the slow, involuntary way of someone whose body had finished with consciousness for the moment. She sat for a minute after he was asleep, not because there was anything left to do, but because she'd earned 60 seconds of stillness, and she was going to take it. The window looked out over the hospital's east wing and the parking structure, and beyond that the highway, the one that had produced this morning's disaster, running its ordinary afternoon traffic like nothing had happened on it. Which was true. Roads didn't remember. They just carried the next thing. Her phone buzzed. Marcus. You need to come back down. Now. Not a question. She stood up. Ikab. The situation that greeted her on the first floor was this. Greer had not waited. Somewhere between being told to wait in the corridor and the 40-minute interview concluding, he had gone to the nurse's station, accessed a second workstation, not his administrative login this time, but a shared clinical terminal, and pulled up the incident report queue. Marcus had seen him do it. Marcus had taken a photo on his phone of the screen before Greer closed the window. He was in the queue for 4 minutes, Marcus said. His voice was very controlled. I don't know what he accessed or changed. I just know he was in it. Emily looked at the photo. The timestamp in the corner was 4:52 p.m. The document hold covered all incident reports from the previous 14 months. Any access, not just alteration, but access, was supposed to be logged and would now be part of the federal record. The fact that Greer had used a shared terminal rather than his own login didn't make it invisible. It made it visible in a different way, the way of someone who understood they were being watched and had tried to find a workaround, which was its own kind of statement. She called Marsh. He did it again, she said. Different terminal. Marcus has a photo. A pause. Where is he now? I don't know. Find out. Marsh's voice had gone into its flat, operational register. Don't approach him. Just find out. Emily looked at Marcus. Marcus looked at the corridor toward admin, then at the trauma bay, then pulled out his phone and made a call. 30 seconds later, he's in the attending lounge. One of the day shift residents just saw him go in. She relayed that to Marsh. Okay. Marsh paused. Emily, I need you to stay on the floor. Don't leave and don't go near him. Sauer is 10 minutes out. He went to get the document hold paperwork from the vehicle. When he's back, we're going to have a different kind of conversation with Greer. Understood. She put the phone down and stood at the nurse's station and did what she'd been told, which was stay, which was one of the harder instructions she'd been given all day. 3 minutes later, the attending lounge door opened. Greer came out. He'd taken off his white coat. He was in shirt and slacks, which made him look simultaneously more ordinary and less settled, like a version of himself that hadn't been fully assembled. He scanned the floor and his eyes landed on Emily, and he walked toward her. Marcus stepped between them. Not dramatically, just stepped, the quiet physical statement of a large man who has decided where he's standing. Greer stopped. He looked at Marcus, then passed him to Emily. I want to talk to you, he said. I don't think that's a good idea right now, she said. I'm not asking about the investigation. Something in his voice had changed. The certainty was gone, had been going all day, actually, chipping off in pieces since the trauma bay. But now there was almost nothing left of it. What remained was something rawer and less controlled, which in a way was more dangerous because raw and uncontrolled men made different decisions than certain ones. I'm asking about this morning, about the patients. She waited. The Hayes kid, he said. Nguyen said the pre-op flag. He stopped. How did you know? About the platelet disorder? His file, she said. I read his file. You read a military medical record from a USB drive you were handed by a soldier you'd never met, in the middle of a mass casualty, in under a minute, and you pulled the relevant flag and relayed it accurately to a surgeon on the phone. He looked at her. Who are you? The attending lounge door opened again. A second man came through it, younger than Greer, early 40s, someone Emily recognized as Doctor. Paul Tressler, the hospital's vice chief of medicine, a man she'd spoken to twice in 18 months and neither time about anything pleasant. He was on his phone. He stopped when he saw the cluster at the nurse's station. His eyes moved from Greer to Emily to the expression on Greer's face, and then to the two IG investigators who had just come through the main doors at the other end of the corridor with Marsh beside them, and the particular forward momentum of people who had somewhere specific to be. Tressler's face changed. It changed the way faces change when someone understands that the map they've been using is not the territory they're standing in. He took one step back toward the lounge. Dr. Tressler, Sauer said from 15 feet away, without raising his voice. "Please don't go back through that door." Tressler stopped. Marsh looked at Emily across the corridor, the look of someone confirming a position, and Emily gave her the slight nod that said, "I'm here, I'm steady, I'm not going anywhere." Sauer reached Greer and Tressler. He had a document in his hand, the official federal hold, physical copy, the kind of thing that didn't leave room for interpretation. "Dr. Greer," he said. "Dr. Tressler, I'm going to need both of you to come with me." Greer looked at the document, looked at Sauer, looked at Emily one last time. And in that look was something she hadn't expected to see, something that was neither anger nor contempt, but something closer to the expression of a man who had just understood the full shape of a mistake he'd been making for a very long time. Then Tressler's phone rang. He looked at the screen. His face went the specific color of someone reading a message they had hoped would never arrive. He turned the screen toward Greer, and Emily was close enough to see the name on the notification. Not a name, a title. Board chair. The call was already going to voicemail. The board chair had called Tressler, gotten no answer, and moved on. Because the board chair was, at that exact moment, 20 feet away, coming through the main doors behind Sauer, with a hospital attorney on one side and a woman Emily didn't recognize on the other, moving with the focused urgency of someone who had received information that changed every calculation they'd been making. Greer saw her. The last of whatever he'd been holding together let go. And in the sudden, terrible quiet of that corridor, the monitors beeping behind the nurses' station, the fluorescent lights indifferent above them, the ordinary hospital air that had carried so many difficult things today, Emily Carter stood without a badge and without authorization and without the title that was supposed to define what she was allowed to do in this building, and she watched 14 months of constructed narrative begin to come apart at the seams. Her phone buzzed in her pocket. She didn't reach for it yet. She would. But not yet. Because Patrick Dower's father was walking out of the family waiting room at the end of the hall, following a patient care representative toward the elevators, and his face had changed completely from the hours before. It had the exhausted, shaking, specific relief of a man who has just been told his son is going to live. He saw Emily across the corridor. He raised his hand. She raised hers. And then her phone buzzed again. And this time she looked. Unknown number, local area code. A text, 4 words. Check the security footage, 4 words. She looked at them a second time, as if the second reading would tell her who'd sent them, or why now, or what specifically she was supposed to find. It didn't. The number was local but unrecognized. The message was stripped clean of anything that made it useful beyond its instruction, and the timing, the exact moment when Sauer had Greer and Tressler in his gravitational field and the board chair was crossing the lobby, felt like either very good instinct or something more deliberate. She texted back, "Who is this?" No response came. She put the phone in her pocket and looked at Marsh, who had watched the text exchange from a few feet away with the alertness of someone who'd learned to read peripheral information. "Someone just told me to check the security footage," Emily said, quiet enough that it didn't carry. Marsh's eyes moved briefly to the cameras mounted in the corridor corners. Standard hospital placement, angled to catch the nurses' station and the main corridor approaches. Specific footage? Just that. No context. "Forward it to me." She held Emily's gaze for a beat. "And stay here." Marsh moved toward Sauer. Emily stayed. The next 20 minutes had the compressed, overlit quality of something that hadn't finished becoming what it was going to be. Sauer walked Greer and Tressler to the administrative conference room for the second time in 3 hours, which gave the hallway the strange double exposure feeling of a scene being reshot. The board chair, a tall woman in her 60s named Constance Alderman, whom Emily had seen exactly once in 18 months at a hospital-wide town hall, pulled the attorney she'd brought into a side office and shut the door. Marsh was on her phone near the window, speaking in the clipped shorthand of someone transmitting information they expected to be acted on. Marcus appeared at Emily's shoulder with 2 cups of coffee. Bad coffee, the nurse's station blend, the kind that tasted like someone had explained coffee to a person who'd never had it. And that was somehow exactly right for 5 p.m. after a day like this one. "Here," he said. She took it. "Thanks. You know what I keep thinking about?" He wasn't looking at her, looking instead toward the administrative corridor. Tina Ortega. She left 8 months ago, said she was burned out. He paused. She wasn't burned out. She was ground down. There's a difference. I know. I should have pushed harder when it was happening. You didn't know the full shape of it. I knew enough. He drank his coffee. That's the part I keep coming back to. She didn't offer him absolution because he didn't want it and because it wasn't hers to give. What she offered instead was the specific honesty of someone who'd been in the same position and made the same calculation at different points. You stay because the patients need someone staying, and you tell yourself the staying is enough. And sometimes it is, and sometimes it's just the story you tell yourself to get to the next shift. When this is resolved, she said, find Tina. He nodded. Tati. The security footage. She got access through Marsh, who got it through Sauer's team, who had already flagged 12 hours of recording across 6 cameras as part of the document hold. The footage itself wasn't new. It was the same system the hospital had always had. Timestamps on everything, archived in the IT department's servers, accessible to anyone with the right credentials. The question was what someone wanted her to see and why they'd sent the message now. She sat at a terminal in a small room adjacent to the nurses' station, one of those unlabeled rooms that accumulates the overflow function of a busy department, and pulled up the archived footage from the previous night. The IT liaison who'd given her access, a young man named Fowler, who clearly didn't fully understand what was happening but understood it was serious enough to cooperate without asking many questions, stood near the door. "What are you looking for?" he asked. "I'll know it when I see it," she said, which was true and also meant she didn't know yet. She started at midnight and moved forward. The corridor cameras caught the normal rhythms of a night shift. Staff moving between rooms, the occasional family member in the wrong place, the particular slow motion of 3 a.m. when the building breathes differently. She watched the nurse's station feed and found herself at 3:38 a.m., and then 3:41, and then her own figure moving at 3:42, unmistakably her, the posture and the efficiency of movement that she apparently carried even when she wasn't aware of it, reaching for the phone. That was what she'd expected. She kept going. At 4:04 a.m., 22 minutes after her documented escalation to Solis, the corridor camera caught a figure moving away from the nurse's station. She slowed the footage. A man, tall, white coat, moving toward the staff break room. She didn't recognize him from the angle. She noted the timestamp and moved forward. 4:17 a.m. Solis's documentation, reviewed, continue monitoring. 4:19 a.m. The same figure, returning from the break room. Better angle this time. She paused the footage and looked. It wasn't Solis. She sat with that for a moment. Then she moved the footage back and ran it again. Not Solis. Solis was shorter, heavier, moved differently. This man was lean, long-strided, with the particular posture of someone who'd spent years in operating rooms bending over tables. She pulled the footage to its clearest frame and looked at the face. Tressler. Paul Tressler, vice chief of medicine, had been at the nurse's station at 4:19 a.m., 2 minutes after Solis had documented his review of Mrs. Kovach's escalation, and 17 minutes before Kovach went into VFib. She pulled up Tressler's credentials in the system log for that night, logged in at 4:21, accessed Kovach's chart, logged out at 4:24. He hadn't just known. He'd looked. He'd looked at the chart, seen the escalation note, seen Solis's response, and done nothing. Not because he hadn't understood what he was seeing, because he'd understood exactly and made the calculation that nothing required his intervention. She pulled her phone and sent the timestamps to Marsh in a text. 3 lines, no explanation because the numbers explained themselves. Marsh's response came back in 40 seconds, sending Fowler back. "Don't close that window." Sauer looked at the footage 3 times. Not because he needed 3 viewings, but because he was the kind of investigator who looked at things the number of times necessary to be certain, and certainty here required 3. Tressler logged into Kovach's chart at 4:21, Emily said. 2 minutes after Solis documented his review, Kovach coded at 4:30. 9 minutes, Sauer said. 9 minutes during which the vice chief of medicine had reviewed the chart, had seen the escalation flag, and had not intervened. She stopped herself from editorializing. She'd said the fact. The fact was enough. Sauer leaned back in his chair. He had the expression of a man who had been doing this long enough to be unsurprised by human failure and who remained, nonetheless, tired by it in a way that didn't go away. This changes the scope of the Kovacs incident. Yes. It also changes what Tressler's position in this inquiry looks like. He looked at her, just, Miss Carter, who sent you the text? I don't know. You have no guesses. She thought about it honestly. Someone in the hospital. Someone who had access to the security system or knew what was on it, who understood the significance of Tressler's presence at that timestamp, who had seen what Emily couldn't see from the nurse's station. Someone who had decided today, after the IG arrived, after the document hold, after Greer's returns to the building, that it was time for this specific piece to surface. Someone who knew and had been waiting for a moment when it would actually matter, she said. Sauer nodded slowly. That's also my guess. He looked at Fowler. I need the full access log for Kovach's chart. Everyone who touched it, from admission to this morning. Fowler, who had been in the corner with the careful invisibility of someone trying to take up as little space as possible in a room full of serious things, straightened up. I can pull that. Do it now. He did. The log had 11 entries. Emily scanned them. Admitting nurse. Solace. Multiple times. Her own escalation note. A pharmacy verification. Solace again. And then, at 6:14 a.m., 2 hours after Kovach had coded, 45 minutes before the morning shift started, Greer. Greer had accessed Kovach's chart at 6:14 a.m., before the morning meeting where he'd blamed Emily. Before he'd stood in that conference room and said the words, the record shows a failure to escalate appropriately. He'd read the chart. He'd read her note at 3:42. He'd read Tressler's access at 4:21. He'd read all of it, and then he'd walked into that conference room and delivered his version of it with full knowledge of what the record actually said. The room was quiet enough that she could hear the ventilation system. He knew, Fowler said from the corner. He'd seen it too. He sounded young when he said it. Not naive, just young in the specific way of someone encountering the gap between what institutions claim to be and what they do, possibly for the first time. He knew, Sauer confirmed. He closed the laptop. I need to make a call. The call took 12 minutes. Emily waited in the corridor. Marsh stood beside her, not saying much, which was a form of company she'd learned to value. Presence without demand, the kind that didn't require her to perform being okay. Tressler, Marsh said at one point, just the name. Tressler, Emily agreed. He was in that conference room this morning. I know. When Greer was blaming you. I know. Marsh was quiet for a moment. They were running cover for each other. They were running cover for the department, Emily said. Greer is the point, Tressler is the infrastructure. Greer made the attributions, Tressler held the administrative umbrella. She paused. It probably started small. One incident, reassigned for a plausible reason, and then it became a system. Systems like that need people to stay quiet. Or people who don't know what they're looking at. She thought about the nursing staff who'd filed accurate reports and never seen the resolution. Both. Sauer came out of the room. The IG's office is authorizing an expanded scope, he said. We're adding Tressler to the formal inquiry. We're also going to need to talk to Solis. His non-response at 4:17 is, at minimum, a professional conduct issue. He looked at Emily. And we're going to need the name of whoever sent you that text. I don't have it. Can you get it? She looked at her phone. The number was still there, still unresponded since her first text. She typed again. The footage mattered. Whatever your reason was for telling me, it helped. I'd like to know who I'm thanking. This time, the response came fast. Halford, James Halford, the name she'd given Sauer 40 minutes ago. Still on the floor, still working, one of the nursing staff she'd identified as having had his own incident reports potentially altered. She'd never spoken to him directly about it. She hadn't known he was watching. She showed Sauer the screen. He read it, nodded once. I'll want to talk to him. He's on shift, she said. Bay Area, probably. He works nights usually, but they're short-staffed. After you, Sauer said, and the politeness of it, the complete neutrality of it, was so unlike the experience of every official interaction she'd had in this building for 18 months that she almost didn't register it as what it was. An acknowledgement that she knew the floor, that she knew who was where, that she was, in this building, the person with the most accurate map. She led him to Halford. James Halford was 38, a night shift nurse who'd been at Redwood Valley for 4 years, and he had the look of someone who'd been carrying something he hadn't known how to put down. He saw Emily coming, and something in his face shifted. Not relief exactly, but the expression of a person who's been holding a breath and has decided now is the moment to let it go. "You got it," he said. "I got it." She stopped in front of him. "How long have you known about that timestamp?" 6 weeks. He looked at the floor. "I work nights. I was there. Not in the unit, but on the floor. I saw Tressler come in. I checked the access log the next morning because I was curious, and then I saw what he'd done and what he hadn't done, and I didn't—" He stopped. "I didn't know what to do with it." "Why today?" "Because today was the first time it looked like it might actually matter." He looked up. "I've reported things before. 2 of my own reports came back wrong, different from what I'd written. I knew something was off, but reporting it felt like—" He stopped again. "Like reporting it into the same system that had already changed your reports," she said. He looked at her. "Yeah." Sauer stepped forward and introduced himself, and Halford straightened slightly at the federal identification, the instinctive response of someone who'd been hoping for exactly this kind of wait and hadn't been sure it would arrive. Emily stepped back and let them talk. By 7 in the evening, the first floor of Redwood Valley Medical Center had the specific character of a building in the process of being understood differently. It looked the same walls, same floors, same monitors beeping the same rhythms, but the people moving through it were moving differently, with a careful awareness of a space that had become, without announcement, a scene. 3 things happened in close enough succession that they felt connected, even if their exact causality was still being sorted out. The first, Constance Alderman, board chair, emerged from the side office where she'd been with her attorney for 90 minutes and walked directly to the administrative conference room where Greer and Tressler were being interviewed by Sauer's team. She didn't knock. She went in, and the door closed, and what could be heard from the corridor was low and controlled and went on for 6 minutes. And when it stopped, the quality of the silence that followed was different from silence that precedes a continuation. It was the silence of something ended. The second, Dr. Solis, who had been paged to the administrative floor at 5:30 and had arrived with the defensive uncertainty of a man who didn't know what he'd been called for, emerged from a second interview room at 7:05 with his attorney beside him and his face the particular color of someone who has been shown evidence they cannot explain their way around. He didn't look at anyone as he walked to the elevators. His attorney walked close and said nothing. The third, Marcus Webb appeared at Emily's elbow with his phone showing a text from Tina Ortega, timestamped 6 minutes ago. She'd seen something on social media. Someone had posted vaguely about serious administrative actions at Redwood Valley, and she'd reached out to Marcus, who was the safest contact she still had there. The text read, "Is it finally happening?" Marcus looked at Emily when he showed her. She looked at the text. She thought about Tina leaving 8 months ago. The ground-down version of burned out, the version that's quieter and takes longer to name. "Tell her yes," Emily said. He typed it. Alderman found Emily at 7:20 in the corridor outside the nurses' station, which had become, by some unplanned logic, the gravitational center of the day's events. Alderman was the kind of woman who had gotten to where she was by being, consistently, the most organized person in any room she entered. Not the loudest, not the most aggressive, but the most prepared. She looked at Emily with the evaluating attention of someone who had been hearing Emily's name for several hours and was in the process of reconciling what she'd been told with what she was looking at. "Ms. Carter," she said. "Ms. Alderman. I want to be direct." She had the voice of someone for whom directness was a practice rather than a personality trait, something she'd chosen. "The board has been reviewing the materials the IG's team shared with us this afternoon. Combined with the security footage and the system logs," she paused. What was done to you and to other staff members of this hospital over an extended period is indefensible. And the actions taken against you today, specifically, represent a misuse of administrative authority that the board does not endorse. Emily looked at her. With respect, Ms. Alderman, the board's employment and credential policies make it possible for the system Dr. Greer built to exist. The oversight structure that should have caught this over 14 months didn't catch it. Alderman didn't flinch. That, Emily noted, was to her credit. You're right. That's also something the board is going to have to address. Okay. I'd like to meet with you formally, tomorrow, if possible, with the IG's team and our legal counsel. I'll be here, Emily said. Alderman nodded once and moved away. Emily watched her go and thought about the distance between indefensible spoken in a corridor at 7:20 p.m. and actual accountability, which was longer and more procedural and less cinematic than any single moment suggested. She'd learned that distance before. She respected the acknowledgement and reserved judgment on what it produced. Her phone rang. Fort Delmar area code, Platt. Ms. Carter, he said. I've been briefed on today's developments. The expanded scope includes Tressler, and we're in communication with the State Medical Board regarding both Greer and Solis. The civil side will move on its own timeline, but I want you to know the federal investigation is formally underway, and your status in this building, a brief pause, is not what it was this morning. She understood the careful precision of that language. Not your badge is reinstated or you're cleared. Both of those were formal processes with formal steps. But your status is not what it was meant something real. It meant the weight had shifted. Thank you, General. Thank Colonel Marsh. She made some calls I didn't ask her to make, and they were the right ones. He paused. One more thing. The anonymous text to your phone, Halford. His 2 altered reports are now part of the inquiry record. His identity as the source is protected under federal whistleblower provisions. Make sure he knows that. I will. The call ended. She went and found Halford, who was charting at the far end of the nurses' station with the concentrated focus of someone doing ordinary work inside an extraordinary day. She told him what Platt had said. He read the information with the careful attention of someone filing it properly rather than reacting to it. Whistleblower protection, he said, federal level. He nodded, looked at his chart, looked back at her. I should have sent that text 6 weeks ago. You sent it today? She said. That mattered. Did it matter for Kovacs? She thought about Mrs. Kovacs in the ICU, stable-ish, being monitored. 64 years old and alive because the code team had gotten there, even if they'd gotten there 9 minutes later than they should have. She's alive, Emily said. Whether the timing of the text changed anything for her specifically, I don't know. But what it changed for the record and for what comes next matters to the next patient. Halford absorbed that. It wasn't a satisfying answer, and she hadn't given it to satisfy him. He seemed to understand that. He went back to his chart. At 8:15, Harlan Greer left the administrative conference room. He walked through the main corridor of the first floor in the particular way of someone who has been in a room where their future was being decided and now has to transit the space where they've spent their professional life with the knowledge of that decision on their face. His white coat was gone. He'd left it in the conference room, apparently, or someone had taken it, or he'd taken it off and not picked it back up. In his shirt and slacks, he looked like himself, but diminished, the way a building looks when the scaffolding comes down and turns out it had been doing structural work. He didn't look at Emily as he passed. She didn't call after him. She'd said what she'd had to say in that meeting room at 10 in the morning, and she'd been right. And being right hadn't been enough at the time. And now it was enough in a way that didn't feel like victory because this wasn't a game she'd been playing. It was a situation she'd been surviving, and surviving it wasn't the same as winning it. Tressler came out 3 minutes later with his attorney, and the attorney was on his phone, and Tressler was not. And the difference between a man who has an attorney who is still managing the situation and a man who has run out of situation to manage was visible in the specific quality of each man's phone relationship in that hallway. Sauer came out last. He stopped beside Emily. We're wrapping for tonight, he said. We have what we need for the preliminary record, Both Greer and Tressler have been formally notified of their status in the inquiry and advised against accessing any hospital records or administrative systems. The board chair has issued an interim order suspending Greer's clinical privileges and Tressler's administrative access pending the investigation. She nodded. The full process will take time, he said. Months, potentially. The institutional side, the state board, the civil claims, these things don't conclude quickly. I know. What you did today, the documentation, the testimony, the cooperation, built the foundation for all of it. He looked at her with the direct, calibrated respect of someone who didn't offer it decoratively. I want you to know that. Thank you. He moved toward the exit. Halfway there, he turned back. One more thing. The alteration Greer made to the incident reports this afternoon. The second access from the shared terminal. We pulled the full record of what he changed. He paused. He wasn't only altering reports about your incidents. He was also modifying the Kovacs report that had been filed this morning after the coding event. The preliminary version, the one that would have set the narrative for any subsequent review. She was still. He was trying to preempt the investigation by establishing a written record before the inquiry locked it. I know, she said. That's what the first text was, too. The 322 alteration from his administrative login. He was building the version of events he needed before anyone could build a different one. Yes. Sauer looked at her steadily. What he didn't account for was that you had already built one, too. An accurate one. Time-stamped, documented, witnessed. That's what made his version impossible to make stick. He let that sit for a moment. Get some rest, Ms. Carter. He left. The floor was quieter now. Night shift was coming on. Different faces. The particular energy of people arriving for the overnight, not yet knowing the full shape of what they were walking into. Marcus was briefing the incoming charge nurse at the station, and Emily could hear the careful, professional summary of a complicated day being handed off in the language of clinical fact, because that was how this floor communicated the things it needed to communicate. She was sitting on a bench near the vending machines, the unglamorous plastic bench that nobody sat on intentionally, but that had been there for years and had therefore accumulated the weight of many people's exhausted moments. When her phone lit up, the unknown number, Halford's number, which she now knew, but he'd texted from a different one the first time. Not Halford. The same number as the check the security footage text. One new message. She opened it. There's something else. Not in the footage. In the billing records. Specifically, the insurance reimbursement codes for incidents where nursing errors were cited. Cross-reference with the altered reports. 14 months. Someone was being paid extra for those coding designations. She read it twice. Then she read it a third time, because the third time was when the full shape of what it was saying became clear. Not just falsification of records to protect reputations. Financial fraud. Insurance billing codes adjusted to reflect errors attributed to nursing staff. Errors that changed the liability designation, which changed the reimbursement structure, which meant every incident report that had been altered over 14 months hadn't only been about protecting Greer or Tressler from professional consequences. Someone had been collecting money. She looked at the number. Same one as before. Not Halford. Who is this, she typed. Same question, third time today. This time the answer was different. Not a name. A job title. Hospital billing compliance. Former. I left 3 months ago. Emily looked at the message for a long moment. 3 months ago. Someone in billing compliance who had seen something in the numbers, who had left or been pushed out, and who had been sitting on what they knew, waiting for the same thing Halford had been waiting for, a moment when it would actually matter. 2 whistleblowers, 2 separate streams of evidence, converging on the same place. She opened her contact list and found Sauer's number. He'd given her his card before he left. And typed the message carefully, the way you type something that is going to matter later. Don't go too far. There's a billing fraud component. I'm getting details now. His response came back in under a minute. I'm turning around. Sauer came back through the main entrance 11 minutes after he'd left, which meant he'd either been in the parking lot or very close to it, which meant some part of him had already understood the investigation wasn't finished for the night. Emily met him in the lobby with her phone screen facing him. He read the text. He read it again. Then he looked at her with the expression of someone recalculating the dimensions of a room they'd thought they already had measured. "Billing fraud," he said, not a question. Reimbursement codes on incidents where nursing errors were cited. If the attribution was changed in the incident report, and the changed attribution affected the liability designation, the billing codes downstream would reflect that. Different codes, different reimbursement rates. 14 months. She paused. Someone in billing compliance saw it and left 3 months ago. They've been sitting on it, or they were pushed out for seeing it. That's what I think too. Sauer looked at the phone again. I need to talk to this person directly. They haven't given me a name. Can you get it? She typed. The investigator needs to speak with you directly. Federal whistleblower protections apply. Your identity will be protected in the inquiry record. Can we meet tonight? The response took 4 minutes, which she spent standing in the lobby with Sauer in the specific patience of people who have learned that some things can't be rushed without breaking. Yes. Not at the hospital. There's a diner on Mercal Street, Callaway's. 1 hour. She showed Sauer. He nodded. I'll bring Park, he said. You should come. I was planning to, but Callaway's diner on Mercal Street was the kind of place that had been the same for 30 years and intended to stay that way. Vinyl booths, laminated menus, coffee that came in heavy ceramic mugs and was refilled without asking. At 8:50 on a Tuesday evening, it was half empty in a comfortable way, the dinner rush long cleared out, a few people working laptops, a couple sharing pie by the window. The woman waiting in the back booth was in her early 40s, dark-haired, with the particular tiredness of someone who had been preparing for this conversation for months and was now inside it and finding that preparation and actual arrival were different things. Her name, she told them when they sat down, was Vera Nolan. She'd been Redwood Valley's billing compliance officer for 6 years. She'd left 3 months ago with a standard separation package and a non-disclosure agreement that she'd signed, and then spent 90 days being quietly uncertain about. The NDA, Sauer said, before she could continue. I know. She'd brought a folder, the kind of physical folder that people brought when they'd learned not to trust that digital records would stay available. I had a lawyer look at it when I decided to come forward. Whistleblower protections under federal law supersede a private NDA when the conduct in question involves federal insurance programs. Medicare and Medicaid were both in the billing stream. They were, Sauer confirmed. Then the NDA doesn't hold. She put the folder on the table. This is 14 months of billing records. I pulled everything I was legally entitled to retain before I left. I've organized it by incident date, correlated with the incident report numbers where I could identify them. She looked at Emily. When I saw what was happening to the reports, the attribution changes, I cross-referenced with our billing submissions. The pattern was consistent. Every incident where a nursing error was cited in the final administrative resolution had a corresponding billing code adjustment. The adjustment moved liability from physician oversight to nursing execution, which under our insurance contracts qualified for a different reimbursement tier. How much? Sauer asked. Vera opened the folder to a page near the back. A number at the bottom, 14 months of accumulated adjustments. It was not a number that described carelessness or administrative drift. It was a number that described a decision. Sauer looked at it. Park beside him wrote it down. Emily looked at it and thought about Tina Ortega, about James Halford, about every nurse who'd filed an accurate report and never seen where it went, about the system that had felt like indifference but had in fact been something with more architecture than that, something that had been built, maintained, and collected from. Who authorized the billing adjustments? Sauer asked. They came through the administrative billing queue, which required sign-off from the vice chief of medicine. Vera looked at him steadily. Every one of them has Tressler's authorization code. The diner hummed around them. Someone laughed at the counter. The coffee was refilled without asking. I should have come forward sooner, Vera said. She said it to her folder rather than to any of them. I kept telling myself I needed more documentation, needed to be more certain. But the truth is I was scared. They'd ended things smoothly enough that I could pretend it had been mutual, and pretending it was mutual was easier than the alternative. You came forward, Emily said. 3 months late. You came forward today because today was the day it would land somewhere that could do something with it. That's not nothing. Vera looked at her. She had the expression of someone recognizing a voice. Not literally, but the quality of it. The specific register of someone who understood the particular texture of waiting too long and then deciding to move. You're the nurse they blamed, Vera said. The Kovacs incident. Among others. Vera closed the folder and slid it across the table to Sauer. Everything I have is in there. I'll cooperate fully with the investigation. Whatever I need to sign, I'll sign. But they were back at the hospital by 10:15. The night had the quality of a day that had used everything up. The parking lot half empty. The entrance quieter. The kind of institutional stillness that accumulated in buildings between crises. Sauer and Park went directly to the administrative floor to brief Alderman on the billing fraud component, because a board chair who'd spent the evening understanding the scope of personnel misconduct needed to understand before she went home that the scope was larger than she'd thought. Marsh was waiting near the main entrance. She'd stayed. Emily wasn't surprised. Vera Nolan, Emily said, by way of summary. Marsh absorbed it. Tressler's authorization codes. Everyone. A long breath. Not visible. Marsh didn't breathe visibly, but audible in the way her silence shifted quality. That takes this from administrative misconduct to federal fraud. Medicare and Medicaid. Yes, though Tressler won't be practicing medicine while this is being adjudicated. I know. Greer either, in all likelihood. I know. Marsh looked at her. How are you doing? It was the kind of question that required an honest answer or no answer, and Emily had learned the hard way that no answer to Marsh was its own kind of answer. She considered it. How was she doing at 10:15 on a day that had started with her badge being set on a table and had ended with a billing fraud document being slid across a diner table and 2 federal investigators going back to brief a board chair on financial crimes? I'm tired, she said, and I'm angry, but the anger's not hot anymore. It's just there, like something I've been carrying around that's been proven to be the correct weight all along. Marsh listened. I'm also... She stopped. Started again. I spent 4 years building something small and quiet here. I thought quiet was the goal. I thought if I kept my head down and did the work correctly, the work would be enough. She looked at the hospital entrance, its glass doors, its illuminated sign, its ordinary institutional face. It wasn't, because the problem wasn't that I was doing it wrong. The problem was that doing it right made me visible in a way that threatened something. Being good at your job threatened people who were bad at theirs, Marsh said. Being good at my job and being a nurse threatened people who needed the nurses to be the weakest point in the system. She paused. That's different. The hierarchy wasn't incidental. It was the mechanism. Marsh was quiet for a moment. You know what you did today. I know what we did today, Emily said. Halford, Vera, Marcus, you. You were the thread they all connected to. Because they were all pulled in the same direction and needed something to pull toward. She looked at Marsh. That's not the same as being the reason. Marsh almost smiled again. The almost smile she'd worn in the parking lot that morning. The small, genuine one that meant she'd heard something true. You've been arguing against credit since I've known you. I just don't want inaccurate credit. Accurate credit is fine. This time Marsh did smile. Small, contained, real. She went home at 11. The apartment was the same as she'd left it, which was obviously true and also felt significant in the way that ordinary things feel significant at the end of days that have consumed everything. A lamp on in the living room. A coffee cup she hadn't washed from that morning, before the 11 p.m. shift the night before. Before any of this. A plant on the windowsill that needed water and was getting by without it, which she respected. She watered the plant, washed the mug, stood at the kitchen window for a few minutes looking at the street below. Ordinary late Tuesday quiet, a few cars, the convenience store on the corner still lit, a dog being walked by someone who looked like they'd also had a long day. She thought about the photograph in her locker. Face down. The one she'd never looked at and couldn't throw away. It was from Kandahar province, taken in the 4th month of her 2nd deployment. She was in it, and 4 other people were in it. And 2 of those people were still alive and 2 weren't. and the photograph existed at the intersection of pride and grief in a way that didn't resolve into either one cleanly. She'd put it face down because looking at it cost something she hadn't always had. She'd kept it because not having it would cost more. She thought about Hayes, waking up in surgical recovery with a rough voice and the specific relief of someone who'd been on the wrong side of a close call and had come back to the right side, asking about the name of the nurse who'd been there, filing it. She thought about Patrick Dower's father, raising his hand across the corridor. She thought about Mrs. Kovac, 64, the ICU, stable-ish, a word she was going to follow up on tomorrow because stable-ish was not the same as stable, and the follow-up wasn't optional just because Emily technically had no clinical standing in the building. She'd find a way. She always found a way. She went to bed at midnight and slept without difficulty, which surprised her, and which in another version of herself she might have interpreted as evidence that she was handling things correctly. She'd long since stopped interpreting her own sleep patterns as moral information. Sometimes you slept because the day was finished. This day was as finished as it was going to get tonight. That was enough. The formal meeting with the board was at 9 the next morning. It was not what she'd expected, which was that she'd expected it to be a process, procedural, careful, insulated. And it was those things, but it was also something more direct than she'd prepared for, which meant Alderman had spent the night with the billing fraud information and had come in with a revised understanding of what the morning needed to accomplish. Sauer and Park were present. Marsh was present. A state medical board representative had driven from the Capitol overnight, which told Emily something about how seriously the billing fraud component was being taken because state medical board representatives did not drive overnight for routine investigations. The hospital's legal counsel was present and had the expression of someone whose job had become significantly more complicated than it had been 24 hours ago. And Alderman, who sat at the head of the table with the compiled materials in front of her and started not with procedure, but with a statement. Ms. Carter, before we begin the formal record, and on behalf of the board of Redwood Valley Medical Center, I want to say directly and without qualification that what was done to you and to the other nursing staff whose records were falsified was a serious institutional failure. The mechanisms that should have prevented it failed. The oversight structures that should have caught it failed. And the people in leadership positions who actively constructed and maintained this pattern of misconduct have betrayed every person in this building and every patient who came through those doors. She looked at Emily across the table. I'm sorry. Emily looked back at her. She let the apology land. Not defensively, not performing graciousness, just receiving it as the thing it was. An acknowledgement from an institution that acknowledgments from institutions were hard to extract, and that this one had required a federal investigation, a billing fraud revelation, and a day that had cost everyone in this room something. Thank you, she said. It's not sufficient, Alderman said. I know that. The formal steps will follow, but I wanted to say it first. The formal steps did follow, and they took 2 hours, and they were less dramatic than the day before, but more consequential in the ways that would last. Emily gave a formal statement that became part of the federal record. The billing fraud documentation Vera had provided was formally entered into evidence. The state medical board representative confirmed that emergency suspension proceedings for both Greer and Tressler would be initiated by end of day, which meant neither man would have active clinical or administrative standing in any licensed medical facility in the state while the investigation was pending. Solis, separately, was notified that his non-response on the Kovacs escalation had been referred to the state board for a professional conduct review. He wasn't in the room. Emily didn't know where he was, and she found that she didn't need to know. At the end of the 2 hours, when the formal record was closed and the investigators had gathered their materials, Alderman asked Emily to stay. The room cleared. Marsh stayed. The legal counsel hesitated at the door. Alderman gave him a brief look, and he left. I want to talk about what comes next, Alderman said. Not as a board obligation, as a practical matter of what this hospital needs. Emily waited. We're going to be running without a functional chief of surgery and without a vice chief of medicine for the foreseeable future. The interim appointments we're making in the next 48 hours are going to stabilize operations, but stabilization isn't the same as rebuilding. She looked at Emily steadily. What we lack, at an institutional level, is exactly what you identified yesterday. The oversight structures failed because there was no one in a position of trust with both the clinical knowledge and the institutional access to catch what was happening to incident reports. We had compliance infrastructure. We didn't have someone who understood the clinical side well enough to know when the paperwork and the medicine didn't match. Emily recognized what she was being offered before Alderman said it. You want to create that position. We want to create a trauma education and clinical oversight role. Someone who works across departments, who has authority to review incident documentation for clinical accuracy, who builds the emergency response training program this facility has never properly had. Alderman paused. The IG's team recommended it, actually, as a structural reform, but we would have arrived there anyway. You want me to fill it? I want you to consider it, with full reinstatement, back pay for the time you were on improper leave, and a formal public acknowledgement of your role in identifying the misconduct. A pause. And your badge, with your name on it, in a building where everyone knows what that means. Emily looked at the table. The morning light was coming in flat and clear through the conference room windows, the particular uninvested light of early autumn that illuminated without warming, which she'd always found honest in a way she appreciated. It showed things as they were. She thought about what she'd told Marsh last night. 4 years building something small and quiet. The goal of keeping her head down. The belief that doing the work correctly was its own protection. That belief had been wrong. Not completely wrong. The work had mattered. The doing it correctly had mattered. Every chart note and escalation call and medication flag had mattered. But the belief that staying small protected you was wrong. Staying small just meant the thing that came for you arrived in a smaller space. It still arrived. I have conditions, she said. Alderman's expression said she'd expected nothing less. Tell me. The incident reporting system needs a structural overhaul. Nursing staff need visibility into the administrative resolution of their own reports, not just submission access, automatically and without request. She looked at Alderman. If that had existed, this pattern would have been caught within the first 3 months. Agreed. Marcus Webb gets a formal commendation for his cooperation with the investigation. And James Halford. Both of their altered reports are corrected in the record, and their personnel files reflect accurate documentation. Already in process. Vera Nolan's separation terms need to be reviewed. If she was pushed out for seeing what she saw, the separation package and NDA were coercive. That needs to be addressed. Alderman looked at her legal counsel's empty chair. I'll have that reviewed today. And Mrs. Darlene Kovach. Emily looked at her directly. She and her family need to be told the truth about what happened the night she coded, not a liability-managed version. The truth. The escalation that was made, the response time, what was in the chart, who accessed it, and when. She deserves to understand what happened to her. The room was quiet. That's going to open the hospital to a significant civil claim, Alderman said, not as an objection, as a statement of fact, the kind made by someone calculating the cost and deciding whether it was payable. I know, Emily said. Do it anyway. Alderman looked at her for a moment. Then she nodded, slowly but without hesitation, which was the best version of that particular motion. Done, she said. Basam. The public statement came 3 days later. Not a press conference in the dramatic sense. No cameras set up in the lobby, no podium with a seal. It was a formal statement released to the regional press and posted on the hospital's website, drafted with input from the IG's communications team and reviewed by the board, and it said in clean institutional language what had happened. A pattern of falsified incident reports, the misattribution of medical errors to nursing staff, a billing fraud scheme tied to those misattributions, and the identification of that pattern through the cooperation of nursing staff and a former compliance officer whose documentation had made the federal case possible. It named Greer and Tressler as the subjects of active federal and state investigations. It named Solus in the context of the professional conduct referral. It did not use the word wrongdoing in connection with Emily. It used the word vindicated, which was accurate and which she read once in her apartment, before folding the printed copy and putting it in the kitchen drawer with the other papers she kept in case she needed them. It also, in the third paragraph, named her directly. Emily Carter, registered nurse. 14 months of accurate documentation. the escalation flag at 3:42 a.m. that had existed in the record and been deliberately used against her, the emergency response during the mass casualty event that had, in the hospital board's formal assessment, prevented additional loss of life, the identification of the billing fraud component through cooperation with federal investigators. It did not call her a hero, which she was glad about. Hero was a word that flattened things. She wasn't a flat thing. Marcus texted her when the statement went up. "They spelled your name right." She sent back, "That's the minimum." He replied with 3 laughing emojis, which was Marcus. She went back to the hospital on a Thursday morning, 2 weeks after the day everything had happened. Not for the new role, that was still being formalized, the structural paperwork taking the time structural paperwork takes, but because Hayes had been discharged and had asked, through Marsh, if Emily would be there. She was there. He walked out of the elevator on his own, which was better than anyone had initially projected. The recovery had been faster than Nguyen expected, though Nguyen had also said something to the effect that people who were in that level of physical condition coming in tended to surprise you on the way out. Hayes was in civilian clothes, had a duffel bag over his good shoulder, and walked with the slight, careful quality of someone whose body had been through something. It was still integrating. His unit sergeant was with him, a broad, serious man in his 40s who had driven from Fort Delmar that morning and who had the particular quality of senior enlisted that Emily recognized as its own distinct register. Not the formal authority of commissioned officers, but something more functional, more permanent. The authority of someone who had been keeping things running long enough that the running itself had become their identity. "Carter," Hayes said when he saw her. "Specialist." She looked at him. "You look better than the last time I saw you." "Pretty low bar." "Fair." His sergeant put out his hand and she shook it. "James Aldridge," he said. "I heard about what you did. The chart, the pre-op flag." Hayes had it in his file. "I just made sure it got to the right place." "That's what everyone keeps saying. The surgeon said the same thing. The investigator said the same thing." Aldridge looked at her with the measuring attention of someone who'd been evaluating people in difficult situations for a long time. "My experience, when everyone in a room says the same deflection about the same person, it means the person did the thing." She didn't argue. "Dorian said you talked to him," Aldridge continued, "when he was in recovery, before he went under, so he said he remembered your voice. I told him we had his chart, that we knew what he needed. He said it was the first thing that felt like someone was actually in charge." Aldridge paused. "In the field, that's what keeps people alive. Not equipment, not protocol. Someone with a voice that says, 'I know what I'm doing and you're going to be okay.' That's what you gave him." She held that. It landed somewhere it was going to stay. They stood in the lobby for a few more minutes, the kind of standing around that happened when a goodbye had already been said and the physical departure hadn't caught up yet. Hayes asked about the investigation, and she gave him the condensed version. He asked about her new role, and she said it was still being formalized. He said he hoped she got it, with the direct sincerity of someone who didn't use hope as a social filler. When they left, she stood at the lobby windows and watched the car pull out of the parking lot. She thought about 14 months, the 342 note, the chart that had always been accurate. Every patient who'd come through those doors and received accurate care from nursing staff who'd filed accurate reports that had been altered by people protecting a financial mechanism. The gap between what the record was made to say and what had actually happened in those rooms, at those bedsides, in the middle of those nights. She thought about the things she'd understood, not this week, not even this year, but in the accumulation of years that had brought her here, about the difference between silence and quiet. Silence was what got imposed. Quiet was what you chose, strategically, while you were doing the necessary work. She'd been confusing the two for a long time. She'd told herself her quiet was chosen when a lot of it had been imposed, and she'd called the imposition management. It wasn't management. It was just surviving in a space that hadn't been built to accommodate what she was. That was going to change. The formal reinstatement happened on a Friday afternoon, in a small ceremony that was not a ceremony but couldn't entirely avoid being one. The board chair, the interim chief of staff, Marsh in dress uniform because Marsh had apparently decided the occasion warranted it, Marcus in his regular scrubs because Marcus was not a ceremony person and had said so. Alderman handed Emily her badge. New one, same name, same credentials, different weight. Not physically, but the weight that came from everyone in the room knowing what it had taken to get it back and what it had cost to have it removed. Emily looked at it for a moment. Emily Carter, RN. The letters the same as they'd always been. The thing behind them different now, visible in a way she hadn't been able to make visible before, not because she'd been hiding, but because the system had needed her invisible and had worked to keep her that way. She clipped it to her scrub pocket. Marcus made a sound that was not quite a cheer and not quite a laugh, and was exactly what the moment needed. "Welcome back," Alderman said. "Thank you." Emily looked at the badge, then at the room. "I need to say something." The room settled. "This," she touched the badge, "matters. The formal record matters. The investigation matters. All of it matters." She paused. "But I want to say clearly that this outcome wasn't about me being exceptional. Vera Nolan filed accurate records for 6 years and saw something wrong and kept it documented until there was somewhere safe to take it. James Halford filed accurate incident reports and watched them come back different and sent a text at the right moment. Marcus Webb stood in a hallway and decided where he was going to stand." She looked around the room. "The reason this worked is that the right people refused to disappear. That's not exceptional. That's what people do when they decide the work is worth protecting." The room was quiet. "But here's what I want to say to anyone in this building who's been in the position we were in, who's filed the right note and watched it get used against them, who's escalated and been told they didn't escalate, who's done the work correctly and been made to feel like correctness was the problem." She stopped. The afternoon light came through the windows, flat and clear. "Your documentation is evidence. Your accuracy is a record. Every time you do the right thing and write it down correctly and put your name on it, that's not just a chart entry. It's testimony. It exists, and it waits." Nobody moved. "They told me I was just a nurse," she said. "I want to be very precise about that word. Just like it was a diminishment." She looked at the badge clipped to her pocket. "A nurse is the person who knows the patient's chart before the attending walks in. A nurse is the person who catches the wrong dosage at 3 in the morning and flags it before it reaches the pharmacy. A nurse is the person who recognizes the rhythm change and makes the call and documents it at 3:42 a.m. and doesn't stop being right about it just because someone with a different credential decides to use it against her." She paused. "If that's just, I'll take it." The room didn't applaud exactly. It moved. A collective shift, the kind that happened when a space recognized something true. Marcus put his hand briefly on her shoulder and then removed it, because that was how Marcus did things. Marsh, in her dress uniform, stood with the very slight, very real expression that meant she'd heard the thing she'd come to hear. Alderman nodded once. The clean, unambiguous nod of someone who understood that what had just been said was going to outlast the meeting. She took her first shift in the new role on a Monday, which felt right. Beginnings on Mondays had a certain structural logic. The role was still finding its shape. These things took time, the messy organizational time of new positions that had to grow into their own authority. She'd have incidents where the scope wasn't clear, and conversations that were harder than they should be, and days where the progress was invisible. She knew that. She'd done harder things in less structured environments. But the morning of that first Monday, before she went in, she sat in her car in the parking lot of Redwood Valley Medical Center for 3 minutes and did something she hadn't done in a long time. She opened her phone, found the photograph she'd taken years ago from the same angle as the one in her locker. Different photograph, one she kept on her phone instead of hiding face down, of the same people, the same unit, the same 4th month of the second deployment. In this one they were laughing. She didn't remember why. She remembered the light and the dust and the specific exhaustion that became ordinary and the specific pride that became structural. She looked at it for the full 3 minutes. Then she put her phone away, picked up her bag, and walked through the doors. The floor was already in motion. The particular morning energy of a hospital coming off a night shift and into a day one. The handoffs and the updates and the low-level organized urgency that never entirely stopped. She knew the rhythms of it. She'd been learning them for 4 years in this building alone, and for years before that in places where the stakes had been measured differently. A nurse she didn't know well, young, first or second year, with the look of someone still calibrating how much of themselves to bring to work, was charting at the nurse's station and looked up when Emily passed. "You're Emily Carter," she said. Not a question, a recognition. "I am," Emily said. The young nurse looked at her badge, back at her face. Something in her expression settled. The specific settling of someone who's been told a thing and is now seeing it, and finding that what they're seeing is both what they expected and also, somehow, more. "I heard about what happened," she said. "What you did." "What I did," Emily said, "was write accurate notes and refuse to stop being right about them." She looked at the chart the young nurse had been working on. "What are you working on?" The young nurse blinked, reoriented, turned the screen slightly. "Patient in Bay 2 post-op, BP trending down. I flagged it for the attending, but they haven't responded yet." "How long ago did you flag it?" 8 minutes. "And your instinct on the trend?" "It's not right. The rate of change is..." She pulled up the graph. "It's steeper than the vitals history suggests it should be." Emily looked at the graph. The young nurse was right. She was reading it accurately, she had flagged it appropriately, and now she was 8 minutes into the gap between the accurate reading and the response it required. "Document the trend separately," Emily said. "Not just the flag. The specific rate of change and your clinical observation. Your name, your timestamp. Then call the attending again." "They'll think I'm..." "You're not asking for their opinion on your persistence. You're maintaining the clinical record and ensuring patient safety. Those aren't the same as bothering someone." Emily met her eyes. "Do it." The young nurse looked at her for a moment. Then she turned back to the screen and started typing. Emily moved through the floor. There were charts to review, a training session scheduled for the afternoon, a meeting with the interim chief of staff about the incident reporting overhaul, and somewhere in the building, Mrs. Darlene Kovach was being moved from the ICU to a step-down unit because Stable-ish had, over 2 weeks, become stable, which was the best version of that particular trajectory. Emily made a note to stop by. She didn't know exactly what she'd say. She rarely did in those rooms. She'd sit with what was there and respond to what she found. That was the skill, not having the right words prepared, but being present enough to find them. Titles don't save lives. Actions do. She'd believed that before she'd ever said it out loud in that lobby. She'd been living it in corridors and trauma bays and supply rooms and diners and parking lots for longer than she'd been able to name. The day was already moving. She moved with it, not invincible, not composed by design, not the version of herself that the story would want her to be, clean and resolved and finished, just here, still here, badge on, name visible, doing the work. That, in the end, was the whole of it. The staying, the accuracy. The refusal to let the record say something other than what she knew to be true, even when the people controlling the record were more powerful than she was, even when the cost of being right was everything she'd built. The record still existed, her name was still on it, and it had waited exactly as long as it needed to, for the moment when it finally mattered.